situation in the county. Alan, good morning.
In the past, we've had the doctors and nurses unions really threatening to down tools countrywide. And of course, remember, it is a devolved service. And so, yes, they have a national union where they subscribe to, but those particular employees, whether on permanent or a contractual basis, actually under the of health. So here in Kakamega, of course, we've actually the health stakeholders here, CEC, the chief officers in charge of public health, in charge of medical services, and of course the other officers in the departments of health tasked with ensuring that health services are actually discharged without any hitch. And of course they have actually told us, of course, off camera, and of course we shall be talking to them in a while. They have talked to us and assured that the crisis that was actually a threat, of course, the crisis that was actually been maybe expected due to the threat, the strike threat by the doctors and nurses union, is not really being felt here in Kakamega due to having engaged those unions, of course, in a round table. And issued strike Kakamega David leader to just maybe shed some more light on the health situation here. Maybe just tell us is collapsing. Maybe have you engaged the unions here of the doctors and the nurses?
Government, the national union, but for the Kakamega chapter, we've been engaging so that we see that services are ongoing without any hitch. So as far as we are concerned, the services are going on, the health workers are working, and all our facilities are on as we continue solving the small issues that we have within our own health system. Yeah.
The county, we've seen some health employees in some counties really complaining that they have actually been on a contract basis for a long time. For how long should the health workers be on contract? And of course, also on the issue of CBAs, of course, unions have actually been agitating for the settlement of the CBAs. But of course, they are working conditions. How is it working? Maybe those on permanent.
You know, for the terms for contractual workers, that one is the work of the Public Service Board, where I sit. I'm not mandated to speak on behalf of the Public Service Board. But what we know that the conditions of the health workers have really improved in Kakamega, and we are continuing to engage so that we improve. A case in example, those health workers that exited best. And we give consideration to those who are on locum within the health system, so that they get an opportunity. Having served in the system for a while on locum, then we know that they are resilient to work with us. Yeah.
I mean, of course.